Thank you all for being here. Oh my goodness, this is such an honor, such an incredible honor to receive this award. And so thank you to whoever nominated me, and thank you to the selection committee. Thank you to the board of directors. It's really an honor to join this incredible, illustrious group of prior people who've won this award, many of whom are here in this audience. And yet I want to emphasize it's an award not just for me, right? To do this sort of research that I do, which is patient-oriented research, takes a village. And there are many in that village who are here in this room tonight. And I've been so privileged to be able to collaborate with so many of you to do all the work that we do. The award, though, is particularly meaningful at this moment because the work that I do mostly has been funded by the National Institutes of Mental Health, as he mentioned. And that research funding is now in jeopardy, as you probably have been reading about. There are proposals for serious cuts to federal funding for research. And we have many research partners, and I'm delighted to hear about IOCDF's research funding. But the federal government is particularly important because of the size of the awards it can give, and also because it can be patient-oriented research. Industry puts funds into research, but it's product-oriented, right? They're going to research things that they can commercialize and sell. That makes sense. But the federal government can actually fund research, which is about what causes disease, but also pave the way to prevention and cures. It can fund things that patients care about and clinicians care about, like what should be the first treatment, what should be the subsequent treatment, does psychotherapy work, et cetera, et cetera. So at this particular moment, one of the things, and I urge everyone in this room, is think about what role could you play right now in advocating for federal funding for biomedical research. I know the biomedical research enterprise, it is one of the things that has made America great. We have been a brain drain for the world. The world comes to us to be trained in biomedical research. We are a leader in the world in biomedical research, in part because of that federal funding. But it's also true, it's what keeps America healthy, because it's actually biomedical research is the only thing that's going to get us to do something differently tomorrow than we do today in terms of treatments. So if you care about future treatments for OCD, or frankly, for any disease, this is a wonderful moment to speak up and advocate that our federal government prioritizes biomedical research for all of our future. So with that, thank you again so much for this award. It's really an honor.